I want you to think for a second about the actual physical act of the last conversation you had.
Like the actual mechanics of it.
Exactly. You drew breath into your lungs, you pushed that air up through your throat, and you vibrated these tiny muscles just to send invisible sound waves across a room. And I mean, think about what you were actually broadcasting out there.
Most people just think about the words they
Right,
choose.
the words, or maybe your current mood, or, if you desperately need your morning coffee. But what if that invisible sound wave is actually a highly detailed medical scan of your physical and psychological state, and you don't even know you're transmitting it?
It really requires a total paradigm shift in how we understand human communication. I mean, for millennia, we've been so incredibly focused on the semantic meaning of the words that we've almost totally ignored the acoustic vehicle carrying them.
And that acoustic vehicle is exactly what we're exploring in today's deep dive. We have some incredibly fascinating source material today. It's an audio segment from Scienza Health.
Right, from their program called The Clinical Signal.
Yeah, which is focused entirely on clinical intelligence for post-acute and long-term care settings.
Which are crucial environments to keep in mind as we go through this. I mean, these facilities have consistently high stakes for monitoring patients, but the resources and staff are often stretched so incredibly thin, they are in desperate need of better monitoring tools.
Absolutely. And our mission today is to look at a tool that honestly sounds like it was pulled straight out of a science fiction novel. We are stepping into the world of voice biomarkers. When I was reviewing the Scienza Health notes, I kept thinking of the human voice as this incredibly complex, totally invisible fingerprint.
Oh, that's a great way to look at it.
Right. Like
Right.
every single time we open our mouths, we're projecting this fingerprint out into the world, and it contains the exact real-time status of our internal health. We just haven't had the right kind of magnifying glass to see the ridges and whorls of that acoustic fingerprint until now.
Well, and the fingerprint analogy works so perfectly because, the data hasn't just magically appeared. It's always been there, just vibrating in the air between us since the dawn of human language.
We just couldn't read it.
Exactly. We just didn't have the biological hardware to process that much simultaneous information, let alone quantify it in a useful medical way.
Okay, let's unpack this. Because before we even get into the specific medical conditions this tech uncovers, we have to fundamentally understand how a machine listens to a voice differently than you or I do.
Right, the actual mechanics of the listening.
Yeah, the source material introduces a specific diagnostic tool from Scienza Health called G. And the sheer scale of the data that G pulls from just a simple vocal sample is, it's honestly staggering.
It's massive. The material notes that G analyzes over 2,500 distinct speech biomarkers from a single audio sample.
Wait, 2,500 variables from one sample?
Yeah, happening completely simultaneously.
I had to pause when I read that number. 2,500 things happening at once every time someone speaks.
And to understand why that is so revolutionary, you have to look at our own evolutionary biology. When we listen to someone speak, our brains are consciously processing, maybe a handful of variables.
Like the vocabulary, the volume.
Right. We
Ah.
extract the words, the overall volume. Maybe we notice if the pitch goes up at the end of a sentence to indicate a question. We get a general vibe of the rhythm.
Sure.
But we are actually wired to filter out the rest of the acoustic data because to our conscious brains, it's just background noise. We evolved to extract meaning and immediate emotion, not to run a diagnostic medical scan.
That makes total sense. It makes me think of like driving in a car and listening to a great song on the radio. I'm just enjoying the melody, tapping the steering wheel. That's human listening.
Yeah, you're just taking it all in as one piece.
But the way G is listening to a voice is like a master sound engineer sitting at a massive digital mixing board in a multi-million-dollar studio.
Oh, staring at the raw digital waveform data.
Exactly. They aren't just passively hearing the song. They see hundreds of individual tracks. The micro adjustments and equalization, the tiny fractional shifts in pitch, the microscopic frequencies our ears can't even consciously isolate. Gia is taking a single sentence and fracturing it into thousands of individual measurable data tracks.
That sound engineer analogy cuts right to the core of why this is such a medical breakthrough. It is all about quantifying the subjective. I mean, historically in medicine, subjective data is notoriously hard to standardize.
Like when a clinician writes in a chart, patient sounds a bit tired today.
Exactly. What does a bit tired or slightly delayed actually mean? It varies from nurse to nurse. But when a machine breaks down the acoustic wave into 2,500 variables, specifically mapping out the exact numerical values of tone, pitch, rhythm, and speech rate, you completely eliminate the guesswork.
You replace a subjective feeling with hard objective math.
Right, you replace a feeling with data.
And the operational speed of this process is what makes it functional in the real world. To get this massive acoustic profile, G requires an audio screening that takes less than 5 minutes.
Which is incredibly fast for that amount of processing.
And once that 5-minute conversation is done, the results are back in just 60 seconds.
That speed is a total game changer for workflow. I mean, a diagnostic tool that takes hours to set up or requires sending samples to a lab that takes weeks, that's inherently limited in a fast-paced care environment.
Right, nobody has time for that.
But a simple 5-minute conversation that yields a comprehensive biometric profile in 1 minute. That just seamlessly integrates into the daily routine of a post-acute facility.
So if this AI is acting like a master sound engineer, picking up thousands of data points in a matter of minutes, it really makes you wonder, what are we accidentally broadcasting?
A lot more than we realize.
Yeah. And if we look at the source material, the most surprising secret our voice gives away isn't even physical. We're moving from the mechanics into the actual human impact, starting with mental health. The Scienza Health segment highlights using G in screening for PTSD.
Post-traumatic stress disorder. Yes, this application takes the technology from an impressive acoustic trick to a really profound clinical tool. PTSD is a remarkably complex challenge in post-acute environments.
Because the trauma often hides beneath the surface.
Exactly. It's heavily masked, especially when a resident is simultaneously dealing with overlapping physical ailments or recovering from surgery.
And the source states that G can help screen for PTSD with an 80.0% accuracy rate. 80% just by listening to subtle vocal changes.
Which is staggering.
It is. And the material emphasizes that this early detection allows facilities to connect these residents with specialized therapy and support groups so much sooner, which directly enhances their emotional stability. But I have to admit, I don't fully understand the mechanism here.
How it actually works biologically.
Yeah, like how does an algorithm separate a patient who just had a bad night's sleep from a patient suffering from clinical PTSD?
Well, what's fascinating here is the underlying biology of why trauma actually lives in the voice. We tend to think of emotional distress as, just sounding visibly upset or crying.
Right, the obvious emotional cues.
But the source explicitly notes that it's not about sounding a certain way. It's about microscopic patterns driven by the autonomic nervous system. When someone experiences profound trauma, their nervous system can become recalibrated. It essentially gets stuck in a state of hyperarousal.
So their body thinks it's constantly under threat.
Precisely.
Wow.
And that chronic state of hyperarousal causes constant low-grade muscle tension throughout the entire body. The vocal cords are very delicate muscles. The larynx is surrounded by muscles.
So the tension physically affects the vocal cords.
Right. Furthermore, the autonomic nervous system controls your baseline breathing patterns. So if a patient has PTSD, they have a fundamentally altered nervous system, which creates microtremors in the vocal cords. It creates shifts in breath support and even variations in cognitive processing speed that affect the rate of speech.
So the machine isn't analyzing their mood at all. It's literally hearing the tension in their nervous system.
That is exactly it. G detects quantifiable biological aspects of speech. The subtle shifts in vocal tone, minute variations in speech rate, and the exact mathematical level of emotional expressiveness in the acoustic wave.
Well, a human nurse might just think the patient is having a quiet Tuesday morning.
Right, but the algorithm sees the acoustic signature of a nervous system locked in trauma.
Okay, but what does this all mean for the patient-doctor relationship? I have to push back a little here because as incredible as that biological explanation is, there is still something deeply unsettling about an algorithm diagnosing someone with a highly personal psychiatric disorder just because their speech rate shifted.
And that is a critical, ethical, and operational concern.
Are we really comfortable letting a computer hand down a PTSD diagnosis?
Well, no, and it's a concern the source material addresses with an absolute boundary. There is a very strict rule established in the workflow. G screens, she does not diagnose.
Okay.
The exact quote from the material is a foundational principle: human in the loop always.
Human in the loop always.
Yeah.
That is a crucial distinction.
It changes the entire framework of the technology. We shouldn't view this as a robot doctor handing out a final psychiatric verdict. We need to view it as an early warning radar system.
Like an air traffic controller.
Yes. Think of the radar. The radar doesn't fly the plane, and the radar doesn't make the decision to reroute the plane. It just tells the human operator that there is a storm miles ahead that they can't see with their naked eye.
That makes a lot of sense.
G flags the acoustic patterns of PTSD, but it is always a human clinician who takes that data, sits down with the patient, builds trust, and makes the actual medical diagnosis. The AI is simply pointing a flashlight at a hidden problem so the human experts can intervene faster.
Okay, that makes complete sense. It's an assist, not a replacement. And, if the voice can reveal the echoes of psychological trauma through muscle tension, it naturally follows that it also reflects our acute physical reality.
Oh, absolutely.
The Scienza Health excerpt pivots perfectly into this by introducing a really brilliant concept called vocal energy.
Vocal energy is a fantastic metric because it quantifies something that we intuitively understand, but we rarely ever measure in medicine. The material defines vocal energy as the amplitude and intensity of sound produced during speech.
The source referred to it as the objective measurement of oomph, which is just such a great, grounded word. How much oomph are you putting into your words today?
Biologically speaking, creating sound takes a significant amount of physical caloric effort. It's a very active process. It requires deep breath support from the lungs, the engagement of the diaphragm, and precise, sustained muscle control in the larynx and the mouth just to push that air out and shape it into words.
So when a patient is exhausted, or maybe fighting off an infection, their body is essentially triaging its energy.
Exactly. The body is remarkably efficient. If your overall energy reserves are depleted, the body diverts caloric energy away from non-essential functions to keep the vital organs running.
And projecting your voice with high amplitude is biologically expensive.
Very expensive. So the first place that physical exhaustion often shows up is a failure to maintain that vocal intensity.
And the data points out that a drop in this vocal energy is an early, highly reliable sign of fatigue, and catching it can actually preempt larger clinical events. But let me play devil's advocate for a second.
Go for it.
If I walk into a room and my friend sounds weak, breathy, or listless, I instantly know they are exhausted. A highly trained nurse is definitely going to pick up on that. So why do we need a 5-minute AI screening to tell a healthcare professional that their patient is tired?
That is a very fair question. And the source material acknowledges that observant nurses are incredible at reading their patients. But this highlights the fundamental difference between reactive care and proactive care.
Okay, how so?
Human perception is governed by thresholds. A nurse will absolutely notice when a patient crosses a threshold and becomes obviously listless or weak. But what about a slow, microscopic decline in vocal amplitude over a period of 4 days?
Oh, like our ears just aren't calibrated to hear a 1% drop in volume from Tuesday to Thursday.
Precisely. Human memory for absolute acoustic values is actually very poor. Furthermore, healthcare settings operate on shift changes. The nurse working the Wednesday night shift might not remember the exact vocal amplitude the patient had on Sunday morning.
That's true.
GIA, on the other hand, establishes a mathematical objective baseline on day 1, and then it tracks microscopic changes over time. It can identify residents whose bodies are physically failing before those patients have consciously realized they are tired.
And certainly before their vocal amplitude drops enough for a human ear to even register the change. It's kind of the difference between waiting for your car's engine to start smoking on the highway versus having a digital sensor that alerts you that your oil pressure dropped by exactly 2% over the last 50 miles.
That is the perfect analogy. It empowers the care facility to intervene proactively. They can adjust a care plan, look for an underlying infection, or modify physical therapy before the patient entirely exhausts their physical reserves and experiences a severe clinical event.
Here's where it gets really interesting, though. We've talked about how vocal energy tracks temporary day-to-day fatigue, but the Scienza Health excerpt takes this a step further into the realm of long-term chronic physical decline.
Specifically looking at neurodegeneration.
Right. They focus on Huntington's disease, which is a devastating disorder that systematically impacts motor functions throughout the entire body.
And we often forget that speech is one of the most complex, high-speed motor functions the human body performs.
When you really think about it, to say a single word, your brain has to send lightning-fast neurological signals to coordinate your tongue, your lips, your jaw, your vocal cords, and your lungs, all within milliseconds.
It's an incredibly delicate balance. And because speech requires such immense neurological coordination, it is often one of the earliest victims of a neurodegenerative disease's progression. As the neural pathways degrade, the high-speed coordination begins to stumble.
The source notes that in the early stages of Huntington's, the changes to the voice can be incredibly subtle, virtually undetectable to the patient or their family. But GIA can map these microscopic changes in articulation, rhythm, and fluency.
And tracking the exact speed and trajectory of that decline is critical for managing a complex care plan. I mean, a doctor cannot simply ask a patient with Huntington's, is your articulation slightly worse today than it was 6 weeks ago?
Right, no patient wouldn't know.
No. And the doctor can't measure it by ear either. But JR provides an exact longitudinal data set on the deterioration of that motor function. That objective data is invaluable for both the initial diagnosis and the ongoing monitoring of how rapidly the disease is progressing.
And I want to highlight a really important technical detail from the text here. JIA is 510K registered.
That is a detail that grounds this entire discussion in clinical reality.
Right, for listeners who might not be familiar with medical regulations, a 510K clearance means this isn't just some experimental wellness app in a beta testing phase on a smartphone.
Not at all.
A 510K clearance means it has gone through the FDA process. It is a recognized, validated medical device. It has been proven to do exactly what it claims to do safely and effectively, and the source material is explicit that has been shown to improve the lives of patients in these care settings.
If we connect this to the bigger picture, it fundamentally changes how we view the burden placed on post-acute and long-term care facilities. The source frames this technology as giving clinicians a powerful new tool in their toolbox. And we know that frontline healthcare workers are currently overwhelmed.
They are managing incredibly complex, overlapping patient needs with severely limited time and resources.
Right. By introducing a technology that requires only 5 minutes, delivers results in 60 seconds, and provides an objective, long-term track of mental health, physical exhaustion, and neurological decline, you are providing immense practical support to those workers. You are essentially giving them a brand new vital sign.
A new vital sign.
Yeah.
That's exactly what it is. We check temperature with a thermometer, we check blood pressure with a cuff, we check heart rate with a monitor, and now we check the acoustic waveform with an algorithm. We are finally able to measure the invisible fingerprint.
And just like a blood pressure cuff, it doesn't replace the doctor's judgment or the nurse's compassion. It just gives the medical team a much clearer, earlier picture of what is happening inside the patient's body.
Let's take a step back and look at the whole journey we just went on, because it really is mind-bending when you put it all together.
It's an incredible leap forward.
We started with a simple 5-minute audio screening. From that one brief conversation, we saw how a system can analyze 2,500 invisible acoustic data points to do 3 vastly different medical tasks.
All at the same time.
Right. First, it can act as an early warning radar for deep-seated psychological trauma, screening for PTSD with an 80% accuracy rate by detecting nervous system tension in the vocal cords.
Yeah.
Second, it can objectively measure the exact oomph or vocal energy of a patient, catching microscopic physical fatigue before the patient even consciously knows they are tired.
Proactive care and action.
Exactly. And third, it can track the long-term, subtle physical decline of a complex neurodegenerative condition like Huntington's disease by mapping motor function. And all of this is accomplished while keeping the human clinician firmly in control of the final diagnosis and treatment plan.
It really represents the ultimate synthesis of advanced computational power and compassionate human-led care. It takes the invisible signals we have been broadcasting our entire lives and turns them into actionable, life-saving medical insights.
So I want you, the listener, to think about your own voice again. The next time you sit down to have a conversation, or you order a coffee, or you just say hello to a friend, remember that you aren't just sending words through the air.
You are broadcasting a highly complex symphony of data.
2,500 invisible acoustic data points. Your entire biological reality, your nervous system, your physical energy, and your psychological state are all layered right there in the sound waves.
It is a profound realization about the human body, but it also prompts a real paradigm shift in how we understand our own health data in the modern world.
Exactly. And that leaves us with one final, incredibly provocative thought to mull over. We've seen how a simple 5-minute recording of our voice in a protected clinical setting contains enough data to accurately screen for deep-seated psychological trauma, physical exhaustion, and neurodegenerative diseases.
In a secure environment, yes.
But what does that mean for our future out in the regular world? We live in an era where we are constantly speaking to smart assistants, shouting commands on our phones, and talking to internet-connected devices in our homes and our cars.
The microphones are always listening.
They are. And the algorithms processing our voices are only getting smarter. If your voice is a highly detailed medical fingerprint, who else might be listening to your biological data?